The National Kidney Foundation launches a new ad campaign urging California voters to vote no on Proposition 8, arguing the measure could jeopardize life-saving treatments for dialysis patients and increase cost on taxpayers. However, supporters argue the measure will hold dialysis companies accountable by mandating they update their facilities. One America's Rachel Ribaudo has more on the ballot initiative.
It's being opposed by the American Nurses Association and the California Medical Association over fear Proposition 8 will force dialysis clinics to shut down across the state, putting the lives of thousands of patients at risk. The November ballot measure would authorize state regulation of dialysis clinics by forcing them to issue refunds to insurance companies if their revenue exceeds their patient care costs by more than 15%. If clinics do not issue refunds within 210 days after the end of the fiscal year, they could be fined up to 5% of the total cost of the refund. Proposition 8 would also limit what insurance companies are required to cover for dialysis care, which could force many facilities to close their doors.
I'm a nurse, and I care for dialysis patients. And I'm concerned about Proposition 8. 8 will force many clinics in California to cut back services or shut down. Join me in the American Nurses Association California in opposing Proposition 8.
In fact, an independent study by the Berkeley Research Group found 83% of dialysis facilities in California would operate at a loss. This could force those suffering from kidney disease into overcrowded hospitals to seek dialysis treatment, which is likely to cost taxpayers hundreds of thousands of dollars.
Proposition 8, another attempt to bring more government bureaucracy into healthcare. 8 imposes new government regulations on every dialysis clinic in California and increasing taxpayer costs by hundreds of millions of dollars. Stop the costly dialysis proposition.
It is being called the Abandoned Kidney Act by the National Kidney Foundation, which has launched an ad campaign against the proposition. Meantime, supporters of Proposition 8 say it would push the state's dialysis corporations to improve the quality of care for patients and provide better working conditions for employees. California's top 2 dialysis companies, DaVita and Fresenius, made a $4 billion profit back in 2016, and supporters say this measure would place a cap on the revenue the companies can earn. Proposition 8 is being funded by the United Healthcare Workers West Union through a front group called Kidney Patients Deserve Better, as part of an attempt to pressure dialysis clinics to unionize workers. But one California kidney transplant patient who spent 12 years on dialysis told the National Kidney Foundation he believes Proposition 8 is nothing more than special interest groups playing hardball with dialysis companies and trapping kidney patients in the middle. For decades, California's dialysis clinics have ranked among the highest in the nation for providing quality treatment. Dialysis patients are required to receive treatment between 3 and 4 times a week, which can cost up to $72,000 per year. And research findings shows missing just one dialysis treatment could increase a patient's risk of death by up to 30%. According to the American Nurses Association, Proposition 8 would severely limit patients' access to clinics, which could very well mean the difference between life and death for more than 65,000 Californians currently on dialysis. Rachel Ribaudo, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.